Welcome to our first episode of HumanX medical case studies. In this video, we will explore how to create a customized model for patient-specific training. This case was brought to HumanX prior to a total hip TEP revision. The provided CT scan indicated 2 incorrectly positioned fixation screws in the acetabulum area. The patient also complained of restricted movement in the hip and severe pain when walking. A key requirement for the model was therefore the representation of the 2 screws as well as allowing full mobility in the area of the joint to examine the existing movement restrictions. The CT scan was provided by the hospital in DICOM format. It has a very low axial resolution of only 2.5 mm. It is important to understand that a model based on a CT scan can only be as accurate as the resolution of the scan itself. As seen in the CT scan, there are some major restrictions limiting the creation of a 3D model. I have already mentioned the low axial resolution. The artifacts caused by the old implant and a low contrast rate also reduce the visibility of the structures of interest. We will try to work around these problems when segmenting the dataset in the next step. Despite these limitations, this is a relatively simple case that can be easily implemented in a model. The printability is very good as we only have rigid bony and metal structures. We can use common FDM printing techniques and materials, which makes the model printable on almost every desktop 3D printer. Let's start with the first step, segmenting the CT scan to create a first digital 3D model. In this specific case, we use the software 3D Slicer to extract the relevant structures from the DICOM images. As you can see in the rendering preview, the artifacts caused by the old implant and the low contrast of the dataset make it difficult to identify any details in the area of the hip joint. After an first orientation with the volume rendering tool, the volume is cropped to the limits of the right side of the pelvis. Using the segment editor, the structures of hip bone, femur and implant are marked layer by layer. The highlighting of the areas of interest had to be done manually, as the low contrast rate and the artifacts are limiting the use of AI-based tools. The whole process took about 1 hour. We tried to capture as many details as possible by also using the available coronal and sagittal views of the DICOM dataset. With this iterative method, we can make sure that the right areas are highlighted. This is important especially where distortions or streaks caused by the metal implant are blocking the visibility of relevant structures. Remember, one of the most important requirements for this model was to enable full mobility in the hip joint. For this reason, the hip bone, femur, and implant were each segmented with a different label. After all relevant structures are segmented, the segmentation is exported into a label map. Using the Model Maker tool, each label is converted into a 3D mesh. This is the final result of the segmentation. It can be instantly used for 3D printing. But as the model has some defects, which can affect the printing process, it is better to do a little bit of post-modeling. During the post-modeling, we try to eliminate all defects and unnecessary internal structures. Missing structures such as gaps or holes are filled to create a closed surface. The surface is being smoothed to recreate a bone-like appearance. When post-modeling, it is very helpful to know which 3D printing technique will be used to produce the model. If you are going to use a resin-based 3D printer, you must follow other design guidelines than when using FDM-based printers. In this specific case, we decided to use a basic FDM 3D printer, meaning we have to simplify the model as much as possible without changing the relevant anatomical structures. This will later help to reduce the overall print time of the model. It will also minimize the risk of failing prints. During the segmentation, the implant was created as a single solid part. To enable the required full mobility of the joint, the 3D model had to be divided into its main components. Therefore, the implant socket and ball joint were separated and completely remodeled. By using HumanX internal database of different types of implants and screws, we also replaced the segmented screws to achieve a highly realistic appearance of the model. The final digital 3D model is now ready for 3D printing. Besides that, it also can be used in combination with AR and VR devices. Remodeling the model took around 40 minutes. As a result, the model now not only fulfills the main requirements mentioned earlier, it also helped to reduce the printing time by around 4 hours. To print the model, we used common FDM technology. The overall print time was 9 hours. As there were no special mechanical or medical requirements for the material, we used basic PLA Plus to build the models. The final model consists of 6 parts. These parts can be assembled without using additional tools or glue. After a little twisting and pressing, the socket snaps securely into place. The 2 screws reaching into the lesser pelvis were inserted into the corresponding holes from the backside of the acetabulum. The shaft is pushed into the femur. And finally, the ball joint is pressed into the socket seat. The final model gives a very good and precise overview of the special pathological situation of the patient. The final model was shipped to the hospital only 24 hours after receiving the CT scan. It was used to find the best solution for the patient. The surgeon decided not to remove the stem of the implant. Instead, he and his team only replaced the ball and the misplaced socket. If you would like to download the model, please follow the link in the video. This link will take you to our online 3D platform, where you can also download other case-related models. If you liked this video, please subscribe. This will also ensure that you receive a notification when we upload the next HumanX medical case study.